Good evening, everyone. We want to welcome you to our Tuesdays with the Doctor. My name is Elder Annette Barnes, and just want to welcome those of us who are with us live tonight and those who will be watching later. Tonight we have a very special guest to talk with us about high blood pressure, a very important topic. We hope that this will be helpful for you or for someone you know. So our speaker will give us a presentation and then we'll take questions afterwards. And you can ask questions by either unmuting yourself or putting your questions in the chat during or after the presentation. So if you want to ask a question anonymously, you can send them in the chat directly to me. And I'd like to introduce our speaker tonight. Holly Gadd has a doctoral degree in nursing and is a family nurse practitioner. She currently serves as Dean of the School of Nursing at Southern Adventist University, where she instituted a lifestyle medicine program for nurses. She is passionate about preventative healthcare and has given many presentations about wellness and health-related topics. Holly has been a nurse for 45 years and a nurse practitioner for about 25 of those years. A variety of medical, surgical, and critical care jobs provided a broad background of clinical experiences during the first 20 years of her profession. Now, in addition to her educator and administrator roles at Southern, Dr. Gadd works regularly in the emergency department and volunteers in medicine as a family nurse practitioner in order to maintain clinical currency and a high level of clinical expertise. And at this time, I would like to turn the time over to Dr. Holly Gadd to share with us about high blood pressure.
Thank you so much, Annette. It's always good to reconnect with Joy of Troy. And so I chose my topic on high blood pressure because February is Heart Month. You know, we've got Valentine's Day and everybody thinks about love and heart kinds of things. And so it just seems like a good topic to talk about high blood pressure and how that affects the heart and stuff like that. And so I'm going to share my screen for most of the time until we get to the Q&A kinds of stuff at the end. And I do look forward to any questions that you might have. And so hopefully what I put together for you will be helpful. So let me get my sharing so that you can look at my screen and instead of me. And so hopefully you're able to see my screen okay at this point. I hope that somebody will speak up if you can't.
Yes, you can.
Okay, good deal. Let me, I've already been introduced. And so, my other connection, most of you know, is that I was born and raised in New York, not too far from the Joy of Troy Church. And I've attended the Joy of Troy Church many times with my parents in the past while they were living there. And so anyhow, it has a special place in my heart. So February, as I already said, is Heart Health Month, and there are many things that affect heart health. Blood pressure is one of those big things that affects the heart. And poor blood pressure control increases your risk of having a heart attack. It increases the risk of you having pump failure, where the muscle just gets too tired to be able to pump to meet your needs. It increases your risk of having a stroke. It increases your risk of having damage to your kidneys, because those tender vessels in the kidney that eliminate your waste don't like to have pressures that are too high all the time. And it increases the risk to your eyes for vision loss, because again, this is about what happens to the vessels when your blood pressure is running too high all the time. And because blood vessels are important for sexual function, it can also create risks for sexual dysfunction. So let's talk about what blood pressure is to start with. Most of us have had our blood pressure checked at some time or another. Maybe some of you monitor yours at home. And so you get two readings. It looks like a fraction. The top reading is called the systolic blood pressure. And that's the maximum force that is felt in your blood vessels as the heart has to pump. And so when blood vessels get narrowed or stiff, we'll talk more about some other risks. The heart has to increase the pressure in order to actually move blood forward. And so that top number begins to go higher and higher. The diastolic blood pressure is the lower number on that fraction. And it is the pressure that reflects relaxation. When the left ventricle is not pumping out into the arteries. And so your heart is just at rest for that little moment of time. And so both numbers are important. We tend to focus a little bit more on that top number. However, both numbers are important. And so how is it measured? Most of you also are very, very well acquainted with that. You get a cuff wrapped around your arm that's called a sphygmomanometer, and usually somebody listens with a stethoscope. We have a lot of automated machines that are used in clinics and that kind of thing. But if you're measuring at home, it really, really is important for you to know some things about the equipment. And so just taking a moment to do that. There are a lot of different devices. Ones that wrap around the wrist tend to be a little easier to use, but they are not typically as accurate. They can actually give you a higher reading than your actual blood pressure. And so it's better if you have a cuff that wraps around your upper arm. And one that is the correct size is also really important. If you have a cuff that's too small, you're using a regular size cuff and you've got a big arm, then you're going to get a reading that again is too high, that it doesn't reflect what your blood pressure really is. If you use a cuff that's too big, and most of the time we err on the side of too small, honestly, but if you use one that's too big, you'll get a reading that is lower than what your blood pressure actually is. So ensuring the right cuff size, just for the fun of it, I took a tape measure and I measured around my arm the other day, and my arm is 11 inches. And so as you can see on the right side of the screen, that the circumference of my arm there means that I can use a regular adult cuff on my arm. So you could actually use this and, measure yourself and decide whether you're actually using the right cuff or not. People who are very thin, of course, need a small cuff. And if you fall in an obese category, usually the regular adult size accommodates a certain degree of overweight. But for sure, once you hit obese, typically you need a large adult. And if you're morbidly obese, very, very extra large, you need that extra large cuff size. Now, what machine to buy? I like economy, and but the cheapest machine isn't the best way to go, really. Omron has been a common name, and I have no disclosures I'll say that. I should put a slide in to say, I'm not supported by or don't get any money from companies that produce supplements or that produce medications or that produce equipment here. And so, I'm not trying to market any particular brand here, but Omron has been a very, very reputable company, and their equipment is not terribly expensive. HealthPoint is one that I'm a little less familiar with, but I see that they have a cuff that may be a little bit easier to use and a little bit more accommodating of variations in size, and yet be very, very accurate. So it's not only important what equipment you have, but it's important how you are measuring your blood pressure when you're doing that at home. So you should be rested and not stressed. I remember one time when I was in graduate school many years ago, and I had come from my advisor's office, and I was really ticked off about something. And I happened to have to go over to health services immediately after this visit to my advisor's office. And they took my blood pressure and they said, "Oh, your blood pressure is like 150 something over 90 something." I don't remember exactly what it was, but it was too high. And they're like, "Do you have high blood pressure?" And I said, "No, but I'm so mad right now." So you got to do your blood pressure at a time that really reflects, I mean, our bodies do react and our heart will respond, but we want to know what you're like on an even keel, not at a time when you're stressed out, or you've just been exercising, or where you're talking to somebody else, or where you've just had a smoke, or and maybe some of our listeners do smoke, I don't know, but that will definitely increase the blood pressure as well. How you sit is important. Sitting in a chair with a back on it, with your feet flat on the floor, not your legs crossed, the cuff not over your clothing but against your bare skin, and your arm resting at kind of the cuff being about the level of your heart is a good kind of thing. So you can see a picture of just the perfect position on your slide there. So what's normal when you check your blood pressure? Well, the 120/80 still holds. We've had some other changes in what's considered normal over time. And sometimes you can't help but wonder if, about all these changes in normal. But between 120 and 130 as a systolic blood pressure is considered elevated. Now, what do you do about that? That's something to just watch, and we'll come back to some of those concepts. Once you hit 130, you actually are considered to have high blood pressure. And if you're over 80, you are considered to have high blood pressure. Now, that's not super high. And there are things that you can do that are very simple. That doesn't necessarily mean you need to be on medicines. And most of my patients, if they are in the 130s over 80s, I'm not putting them on a medication, but I may be recommending some of the things that we're going to spend most of our time talking about today. Once you start hitting 140/90, getting to that stage 2 high blood pressure, then medications often are necessary. And the higher the blood pressure is, the more likely it is that you're going to need medication, maybe more than one medication, and other types of interventions. And so we'll talk about some of those kinds of things. The hypertensive crisis, because I work in the emergency room as well as in internal medicine, I often see people with pretty elevated blood pressures, and those readings also need to be put together with a person's symptoms. If you're measuring your blood pressure at home and you are finding something really, really high at 180 over, or higher on the top, or a high low number, 120, and more often we see the top number being elevated. For one thing, you need to make sure that you've done all the right things in measuring. And then you need to step back, wait 5-10 minutes if you're feeling okay, and check it again. Don't panic. It's not going to help anything. It's only going to shoot your blood pressure higher. But if you're having severe headache or weakness, can't talk, symptoms of a stroke, if you're having chest pain, you're short of breath or something like that, and that truly is a hypertensive crisis. So it's about not just the numbers, but how you're feeling at that time. That's really, really important. And so when you see those high numbers, if you have other things that are going on that are making you feel ill, particularly the chest pain or any neurologic kinds of things that would be like a stroke, the weakness, the trouble talking, something like that, the confusion, then it really, really is a crisis, and you need to be 911ing it and getting to emergent care. Okay, but we're not going to spend time in that zone. We're going to talk about some of the simpler kinds of things for the most part today. High blood pressure has often been nicknamed the silent killer because most of the time people with high blood pressure don't feel it. They feel fine. And sometimes it's hard to comply with the treatment plans for managing high blood pressure, because sometimes actually the treatments can make you feel bad in some way. We'll talk about some of those things where you didn't feel bad before. And so, or because you don't feel bad, it's just hard to take a medicine all the time. And so I love this particular statement on the screen. If you could keep a blood pressure, a systolic blood pressure, that's the top number, of less than 115. This one says, if you're greater than 115, it's the most important determinant of dying. Okay, so keeping less than that is a good determinant of not dying. All right, so what are our goals? Well, I just said 115 would be a really nice target, and anything under 120 over 80, is good to a certain degree. Of course, we don't want to see something under 90 as your top number. But anyhow, if you have high blood pressure, what should you target? In other words, if you go to the doctor's office and they check you and they check you again and they check you a third time, because really you can't diagnose high blood pressure just with one reading. You need at least 3 readings on different times in order to be diagnosed with high blood pressure. And they all need to be high. And so if you're over the 140 over 90 reading consistently at a provider's office, then you deserve treatment. And your goal is to get under that 140 over 90. Now, if you have other health problems like diabetes or heart failure, or kidney disease, then you have lower numbers that you should be targeting. And you can see some of those. They're 130 over 80 if you have heart failure or kidney disease. And, the better you can get yourself, even if you don't have those chronic problems, is good. So the other thing too that I would say is that when you're setting a goal for your blood pressure, you really, it needs to be age dependent. My dad would be, in his 90s now, where he's still living. And, we would need to be really careful about his blood pressure. You start getting up into the high 70s and into the 80s and 90s, and it really depends upon the overall health and how frail an individual is. But we get much more liberal on our goals as somebody gets older and more frail, because medications can make them at risk for falls and other complications. So, it's a complex kind of thing that you have to work together with a healthcare provider to set the best goal for you. So it really is highly individualized. So the benefits, just a drop of 7 points, 7 millimeters of mercury. That's what the mmHg is. 7 millimeters of mercury, or 7 points on the lower number, would be expected to result in a 46% decrease of stroke and a 29% decrease in heart disease. If you drop the top number 10 points, it's a 36% decrease in stroke and a 27% decrease in heart attacks. And so, you can see that small changes can make a big difference in that stroke risk and the heart attack. And those are big deal kinds of health problems. And so we're going to talk about some things that can move you easily that way. Sometimes a medicine will do that. They don't always move you huge amounts, but you'll see some other things that you can do that will give you that 10 points pretty easily. All right, let's go back and think about some of the causes of high blood pressure. And I want you to look at this slide and think about how many of these things you could actually change. Okay, almost all of them, actually. Your weight, how much exercise you're getting, whether you're getting out and getting your vitamin D in the sun, and whether or not you smoke or use alcohol or too much caffeine to try to stay awake, how much processed food you eat, that fast food kind of stuff, or the stuff that's in bags and cans that's highly processed, high stress, what your life is like, how well you sleep, and whether you have sleep apnea, whether you work a night shift. Now, sometimes that's not particularly changeable there. Use of illicit drugs, we put that over there with the alcohol and smoking, that can definitely have effect. Medicine, some of the things that we take that we think are either over the counter, and so they're pretty benign, but cold medicines can increase your blood pressure, and pain medicines like ibuprofen and Aleve, those kinds of things can increase your blood pressure. And there are a number of prescription medications that can do that as well. And then if you have some other diseases of other organs, your kidneys, your thyroid, and an overactive thyroid particularly, if you have an adrenal problem where you're putting out too much of those stress hormones, so that can be a problem. So some of those things we have more control over than others, obviously. We can't control our genetics, a family history, or our age. We're all getting older every day. So there are a lot of things, though, that we can control. And the basis of treatment for high blood pressure is lifestyle changes. Even traditional medicine, you don't have to be a Christian, an Adventist, it doesn't matter what religion you are. It doesn't matter what your perspective is on health and all that. The bottom line is that everybody says that lifestyle is an important starting place for management of high blood pressure. That's traditional standard guidelines. Medications are also highly used and very important. So, but we're going to spend quite a lot of time talking about the lifestyle kinds of things. And for those of you who have heard me speak before, you know that I love the Creation Health framework, because this is done by the Advent Health System, and it looks at factors that impact our health in ways that are pretty simple. Are the choices we make, how much rest we get, what our environment is like, how active we are, how trusting and how we relate to other people, what our outlook on life is, and our nutrition. And so I'm going to take those 8 concepts and give you a little bit of idea of things that you can do in regards to each one of those for managing blood pressure. And then we'll talk about medicines a little bit too. So choice, all of this is about choice, and what I want you to see off of this slide is that, when you talk about weight or diet or managing how much salt you take, my dad used to pick up the salt shaker and salt his food without even tasting it. That was my dad. He never had high blood pressure, but, if he did, we'd have started saying, hey, Dad, maybe not so much of that, but and alcohol, physical activity, each one of these items on here, you can see that you can reduce your blood pressure by 4, 5, 6, 11, and for every kilo, which is about 2.2 pounds of weight reduction, you get every 2 pounds, you get 1 point. So if you lost 10 pounds, that's 5 points. If you lose 20 pounds, you can make some really significant differences in your blood pressure. Even if you're overweight or obese, you don't have to get to normal weight to make a huge difference in your blood pressure. So, and putting these things together, start adding up those things in the column on the right there, and think about, you can actually do better with lifestyle in many times with a commitment. And when you combine things that are personally beneficial for you based on your risks and all that are equivalent or better to a medicine. A couple of other things, you see the same kinds of blood pressure impacts with reducing caffeine or coffee intake. Intake of 200 to 300 milligrams can increase your blood pressure by 8 systolic, 5 or 6 points diastolic. So by eliminating that, if you're a consistent caffeine user, now I probably use caffeine, maybe 4 or 5 times a year. I don't know if I'm traveling somewhere on that I'm having trouble staying awake driving or something. I mean, I'm not a consistent one. And so we're not talking about that kind of a pattern. We're talking about the everyday caffeine user who has to wake up and have their cup of coffee and, or drinks their Red Bulls or their Monster beverages or whatever to try to stay awake. That person who has high blood pressure may gain some benefit from reducing or eliminating their caffeine. We talked a little bit about those over-the-counter drugs like ibuprofen or Aleve. Those are called non-steroidal anti-inflammatory drugs. That's what NSAIDs stands for. And it really depends, again, upon how much you're taking and how often you're taking it, how much impact it has on blood pressure. But if you're on a certain type of blood pressure medicine called a beta blocker, that's the BB on the slide there in the middle, those work against that particular drug as well. And so we have to be really careful with that. You can see 3 to 5 points of difference there. Yoga, I'm not into yoga, but some people are. And, it involves a lot of relaxation kinds of things, breathing kinds of things, meditation. And meditation can be done in some different ways. That maybe sometimes I would question how those are done, but there may be some benefit that would fit with what you think is okay for you. So we've talked about kind of choices overall there, and we've hit on a few aspects, but now I'm going to try to move us through the creation health. And so we're going to talk about rest. It is normal for your blood pressure to dip at night. And for some people, their blood pressure doesn't dip well. And that can be because of their stress. It can be because of medications. It can be weight related, and there may be some other genetic factors or other medication factors to that, but that is really important. And so sometimes people who are having trouble controlling their blood pressure actually do a little bit better. A lot of people will take their blood pressure medicine in the morning but nothing in the evening, and so sometimes it really helps somebody to split their medicines. If they're taking 2, take 1 in the morning and take 1 at night, so that it helps better with that nocturnal dipping. Sleep problems do cause more problems with high blood pressure. And that can be problems with insomnia, sleep apnea, restless legs, just short sleep times. 30% of Americans are sleeping less than 6 hours a night. That's not good. And anything less than 5 hours per night, it gives a 60% higher risk of high blood pressure over an 8 to 10 year time period. So, you don't want to go past, the ideal is 7 or 8 hours. If you get up into the 9-hour category, you're also creating some heart risks. And so you want to hit it right and target that 7 or 8 hours. And longer sleep duration and better quality does help to manage blood pressure. So working on sleep is one thing you can do. Managing your stress is another kind of thing. Stress, you think about when somebody pulls out in front of you at an intersection and you just about have a car accident, that can be really tough and stressful. You get that surge of adrenaline, and, cortisol is a stress hormone, and those kinds of things, hormones can raise your blood pressure even 15 points. So, there are a lot of things. Being in an environment where the colors are relaxing, your greens and blues, doing deep breathing, meditating, thinking about God's word. I think of meditation not just in the kind of thing, but or repeating some word over and over again, but meditating maybe on God's word and his promises and things that are important. Exercise helps reduce stress, and some aromatherapies, you may choose to do something like that using lavender, lemongrass, or one of the things that's listed here. There are a lot of things that can be used, but lavender is one of the most common ones. Activity, I've mentioned that as stress control, but it does naturally reduce the blood pressure. And your target is 30 or 40 minutes a day. You're trying to do it most every day of the week, getting a moderate level where you actually have, are breathing a little bit higher. And there is a relationship between how much you do and how well it's going to work for your blood pressure. Getting up and moving around, if you've got a sedentary job, is a good thing too. Trying to get about 3 minutes of every hour moving around. 5 is even better. And whatever you do to try to encourage that, having an exercise buddy, making it something you enjoy. My husband loves to swim. I hate swimming. He likes to walk. I would rather ride a bike or run. And so, find something that you like, somebody you like doing with it. Pace yourself so, you don't start so much, so vigorously that you hate it after the first day and can't go back. And of course, sometimes it's a good idea, if you feel you have health risks, you can do an exercise questionnaire. That PARQ and U is one that's commonly used. And if you have yes answers on that, then it's best to see a provider before you start exercising. And of course, you should always stop if you develop chest pain and seek help. Trust. Does religion have anything to do with blood pressure? Well, there are actually some studies that show, even when they control for diet and exercise and other lifestyle factors and how often you go to church and all that kind of thing, that your intrinsic religiosity, and that is your desire for God and a relationship with God, is strongly related to your blood pressure and lower hypertension rates. And so higher levels of spiritual well-being are a good thing, and seeking after God. I like the promises that are here that talk about trust, that God never changes. He's powerful. He's there to help us. He knows who we are and what we're doing, and he's with us. He can give us wisdom. He's faithful to meet our needs. Sometimes we don't understand everything, but he is good. He does love us. He is merciful. And so there are many promises that we can meditate on and that we can use to develop our trust. Interpersonal relationships is on the list as we come down our creation list, and social support is probably one of the important elements to think about, in that people who have somebody around them to encourage them are more likely to be compliant with the natural things that they choose to do, as well as with medications. And those relationships, we all know of people who just push our buttons and who irritate us. And so when we have negative feelings or ambivalent feelings about somebody, that's likely to raise our blood pressure. And so trying to find environments that support good feelings, working through, and sometimes that means going to counseling or, confronting somebody and trying not to hold on to grudges, being forgiving, working through the conflicts that one has. Those are all ideal things to try to keep from being in that stressful interpersonal relationship thing that increases your blood pressure. Just working on those interpersonal relationships can have an impact. We want to have loving attitudes, forgiving attitudes, and those will help our blood pressure. We also want to have a good outlook on life. I grew up with parents who were quite opposite. One was kind of a pessimist and one was an optimist. And there was a difference in their blood pressures and in their heart health as well. So gratitude and optimism predict lower blood pressures. 22% lower risk of high blood pressure in those who rate high optimism when they're tested with certain optimism pessimism scales. And optimists tend to engage more in some of these creation health, some of the natural kinds of things. I don't know whether pessimists just think it's not worth it or whatever, but also pessimists tend to have less nocturnal dipping. We talked about how that was so important in creating heart health, that your heart is able to take a rest during the night too, by not having to generate as much pressure to circulate your blood. And so optimism, pessimism, gratitude in everything. God says, give thanks, not for everything, because there's some things that is pretty hard to give thanks for, but in everything, in spite of, because we trust in God. All right, so now we're down to nutrition. And we're going to try to wrap up with just a couple of things about nutrition and then medications, and then give a few minutes for questions. So nutrition, I want you to look at the hypertension column on the right-hand side, and you see the highlighting. I mean, there's also some interesting things about diabetes on the same slide, but you look at a non-vegetarian versus a semi-vegetarian versus a pesco-vegetarian is somebody who eats fish. And the lacto-ovo, which the person who uses dairy and eggs, that was kind of the way I was raised. And then the vegan, who's completely plant-based. And so you look at the weights and the prevalence of high blood pressure, that there's 1/4 of the incidence of high blood pressure in those who are vegans versus those who eat, the standard American diet that includes meat and everything else, that are non-vegetarian. But you can cut it in half by being a lacto-ovo vegetarian, reduce the risk by about 1/3 by just having fish in your diet instead of the other red meats and that kind of thing. So, diet is an important thing, and, more plants are better. So the dietary interventions, and this slide really just looks at some of the things that you can do, and it talks about some of the common diets that are recommended. Just what you hear from most healthcare providers, limit your salt a little bit and eat more veggies, and they don't give you a lot of instruction. You might be able to drop 5 points if you're good. But you see here this range of, maybe 2 or 3 points up to 8, 9 points, depending upon what type of diet you're doing. And so those are good things. That's about equivalent to what a medication does in some instances. The New Start program, which is really a different name for the same kind of thing as Creation Health. You can see the same concepts on the left side of your screen. But a study done, and I think the next slide may have the reference for that, or I have it at the end, but a study done several years back on people who did the New Start program, because they put so many of these lifestyle things together, they were able to reduce in just 2 weeks' time almost 20 points on their blood pressure. A 93% drop in the need for blood pressure medicines. The use of blood pressure medicines was discontinued in more than 2/3 of the participants in the New Start program, and another 1/4 of individuals were able to decrease their medications. So that whole compact, deal where you're putting all these lifestyle interventions together, trying to do a little bit of this, a little bit of that, the exercise, the diet, the stress, the spiritual kinds of aspects, good water intake, low salt, all these things at once can really have a super nice impact on your blood pressure, and sometimes eliminate the need for medications. Now, are there some other things? Yes, I teach my students other things, because I know there are a lot of people out there that don't want to take a blood pressure medicine. And one of my colleagues used hibiscus tea for a long time. Similar blood pressure drop to one medicine, about 7 points. Pomegranate juice. Well, some of these are kind of expensive. Hibiscus tea isn't particularly, but beetroot juice. And again, these are things that you can try, and some things, just like some medicines work better with certain genetics, and we don't really know all of your genetics when we're putting you on a medicine. The same is true of some of these other nutritional supplements, that we won't know exactly how they will work, but they can be worth trying if you're somebody who wants to go more natural routes. The beetroot juice, when I was looking looking at some information online about that. You can get it as a gummy and chew it. So it'd be kind of like a candy treat, I guess. You can get it in a capsule form, so you don't have to taste it at all, or you can get it in a juice. Most of us like chocolate. I know a few people who don't. You need the intense chocolate, a 50 to 70% cocoa, but you can again get some decreases in blood pressure there. Green tea, black tea, garlic. Garlic can make you kind of stinky, so there's some odor-free capsules. But again, you see that there are a number of things that you can choose from that might have impact on your blood pressure. A few points here or there, and it just depends upon what you want to choose. It's all about choice. So let's talk about medicines in the last few minutes here. There are many different types of medicines, just like there are many different types of herbs and nutritional supplements and things that you can do. But the most common ones that I've listed here, I've used their abbreviations. The angiotensin converting enzyme inhibitor, that's the ACE inhibitor. The ACE receptor blocker, which again works on the angiotensin, but it works in a different place. And angiotensin angio talks about the blood vessel. Tension is just what you think it is. And so these medicines inhibit that through different enzymatic pathways. And so they make your blood vessels more open, which drops your blood pressure. And so those two are related, and you should never be on both of those at once because they are so related. The beta blockers work more to block some of the stress impulses from your brain and the effect that the stress impulses have on your blood vessels, which again is stress makes your blood vessels tighten down, because when you need to have your fight or flight reflex, you need the blood in the core parts of your body to keep your organs, your brain and your heart and your lungs and your kidneys alive. You don't need it all out there in your fingers as much. And so the beta blockers work there to reduce the stress hormones and that contraction. So those are a little bit different in how that works. Well, they don't, anyhow, we'll leave it at that. The calcium channel blockers work by blocking the calcium that helps for vessels to contract. And so when you block that, again, it helps the blood vessels stay open. And diuretics are very, very commonly used. Those help you eliminate water, and so less volume in the blood system, in the blood vessels, also reduces your blood pressure. So a lot of times we see these things used in combination, and so you might have somebody who's on an ACE or an ARB, and they might be on a calcium channel blocker too. And if you got a lot of problems with blood pressure, might be on some type of a diuretic as well. And there are several different types of diuretics, and there are some other medicines that can be used as well. So combinations are very, very common. And sometimes they're put into one pill. Sometimes they're taken separately in two different pills. But being put together in one pill makes it easier because you're only having to swallow one. And sometimes it helps with some cost savings as well. All medicines have side effects, however. And so, they can vary from a cough that can be developed with an ACE inhibitor, or even your lips blowing up and you having a terrible allergic reaction, to fatigue and dizziness if your blood pressure gets too low, or the beta blocker just making it so your heart can't speed up enough sometimes when you really want to do something vigorous, or calcium channel blockers that can make you swell a little bit in your ankles, diuretics that can then mess with your potassium balance, or so there are a lot of things, downsides to the medicines, but there are a lot of downsides to having a heart attack or a stroke or kidney failure or going blind too. And so medicines are very necessary and useful for management of blood pressure. And so it is important to recognize that balance, not be afraid of medications, do what you can with your lifestyle, but be willing to work with your healthcare provider to really achieve the goals and reduce your risk of having something bad happen to your brain or to your heart or to your kidneys or your eyes or whatever. So many benefits that one experiences. So anyhow, those are medicines. So better blood pressure, that's the goal, whichever route you take. And sometimes just taking baby steps towards health and fitness. Remember, even moving the pressure just 5 or 10 millimeters of mercury, 5 or 10 points can make big benefits for you. And so you can do that through so many different routes, through fitness, weight loss, and just little baby steps. And if you fall off the wagon sometime, babies lose their balance really easy, but they get back up really easily. I've got a 11-month old grandchild, and when she falls over, she just gets right back up. And so that's what we have to do when things don't work quite right. If it's a medicine that creates a side effect that doesn't work right, you go back and you talk about it and you regroup and you get on something that works a little better for you. All right, so this is the question and answer time. I'm going to stop sharing as soon as I can here. Let me see how I can get to doing that. Where's my stop share thing? Let's see.
Maybe over on the right-hand side?
Yeah, it is.
Upper right, maybe?
Yeah, it's because I have different...
There you go.
Okay,
Nope,
did
no, maybe
I
not.
get it? All right, let's see.
No, I think we're still viewing your screen.
All right.
Here, I think I can.
Now I finally got it. So okay,
yeah,
you got me unshared.
I did.
All right, good. Yeah, I finally got to where I could see the green unshare thing again. And so anyhow, any questions? I don't see anything in the chat box right off. So.
Yeah, we do have a few that have come in.
Okay. Right.
One is, what is the portfolio diet?
The portfolio diet. Well, that's a really good question. And I think I talked a little bit about that one. And I think that is a little bit more, I think that was on one of the slides, and it's a little bit more individualized. It is plant-based, and it is very, very high fiber, has a lot of soy in it and nuts and that kind of thing. And so it really gets you a lot closer to the vegan plant-based diet.
Oh, okay. Interesting. Is it something that is specific for a certain person? Like it might be a little different for each person, or?
I think you can definitely individualize it there to the things that work best for you. And of course, if you're trying to maximize your fiber in a diet, beans are always the best. So choose your beans.
Choose your beans. Okay, choose your beans carefully. Cocoa bean, maybe. No, okay.
Yeah, that can be on the list, though. That, we know that there's a little bit of benefit if you choose the right one there.
Yeah, I like that. Chocolate was on the list to lower high blood pressure. I thought that was pretty cool. So another question, and I am not going to pronounce this correctly, but what is the difference between amlodipine and losartan?
Okay, so losartan is one of the ACE receptor blockers, and amlodipine is a calcium channel blocker. And so they fall in two different categories in how they work to lower the blood pressure, and they can be very complementary and are often given together.
Oh, okay.
So the average number of blood pressure medicines in the United States that is needed to control blood pressure is 3.2. Now, nobody's taking 0.2 medicines, but most people require 3 medicines. And that's because a lot of them aren't doing anything in the way of lifestyle. Lifestyle is the hardest thing for people to implement. And so, like I said, the amlodipine works differently. It's that calcium channel blocker. It interferes with the calcium that's needed in order for blood vessels to contract. And then the losartan is a ACE receptor blocker. So it's working on that angiotensin, a different type of enzyme that affects blood vessel tension.
Interesting. So there's not one medication that does it all.
No.
Affecting
I mean,
different
if
parts of
you've got a blood pressure of 142/90, hopefully you can manage it with lifestyle. But if you need, you usually control blood pressure and get you at goal with one medicine when you're in the 140s.
Oh, okay.
So
but you did go ahead.
Go ahead.
I was going to say, you did mention that if you're on like medications for other things, it could affect your blood pressure, right? So, and then you might have to get on blood pressure medication because it was a side effect of another medication that you need.
Exactly.
So that kind of gets you into a cycle that's hard, because lifestyle, does that mean lifestyle doesn't necessarily can't really help that because it's a side effect of another medicine?
Well, no, lifestyle can still help under those circumstances, because lifestyle kind of counteracts the blood pressure effects even of medications that are increasing it. And so, if you got to take steroids forever, that may be, it's going to increase your blood pressure a little bit. And, there are other drugs that will do this and also do that. But, it's all risk and benefits.
So we had another question coming in. Which one is safer to take?
Of the medicines?
Yes.
It really depends upon the individual and their age, and their ethnicity, because like a calcium channel blocker works better in an African American. And so is it safer? Well, it's better because it works better just based on genetics for whatever reason. So there are some differences there. Beta blockers are lower on the list unless you've had a heart attack and you're trying to protect the heart after a heart attack. Beta blocker is definitely not a first choice in those common blood pressure medicine categories. And probably I would say that the ACE receptor blockers, like losartan or valsartan or, whatever those sartan categories of drugs, those probably have a good safety profile and less side effects, probably a little bit less side effects than some of the other drugs.
Interesting. Okay, so it might just depend on your whole genetic makeup, and
It sure does.
Go to your doctor and find out, right? Yeah, interesting. All right, so you mentioned some other things. So going back to like the hibiscus tea and pomegranate juice and beet juice and chocolate, some of our favorites.
How much do you have to do is the question, right?
Well, and how long, right? Like how long?
It depends upon the other things that you do. So how long do you need to use hibiscus tea? If you lose weight and you're exercising faithfully at the same time, it may be that you're using that in hibiscus tea on all three things. You've made great strides, and that ultimately you could drop the hibiscus tea off. We can de-escalate when people are doing really, really well. De-escalate drugs, you can de-escalate the other lifestyle things to some degree. And so if you chose to do something like that, you might be able to do it for a period of time until you got into good control, and then start doing it less if you were still doing other things to help your blood pressure. But most of the time, blood pressure, you can't think, hey, I'm going to do something for 3 months and it's cured. It's a chronic disease.
Interesting. Yeah. So two things on that. So one, you did mention like how much, and oftentimes when you hear, oh, you should drink, this herbal tea or whatever, it's like 4 cups a day or something crazy, right?
Yeah,
so
it is. Yeah.
Is that true?
There, I think that in some of the studies that I looked at, I'm trying to think back, they were not talking about insane kinds of quantities that, it was 2 or 3 cups a day or something like that. It wasn't insane amounts, but you'd really need to talk with somebody at a nutrition store who does a lot of that kind of thing. There's a place that I go to and they have a book, and there are some things online. You can't believe everything online, but there are some good databases available that have some very reputable information. And so and certainly if somebody wanted some very, very specific details, I didn't put tons of details in there, but I'd be happy to provide some other insights there.
Okay. Yeah, that would be interesting. You mentioned that it might take, it's going to take longer than 3 months or something, but you also mentioned in your presentation that, doing New Start can lower your blood pressure within 14 days.
Mm-hmm.
I mean, is it one, how would you know that you're now low and, and you're going to stay low? And 2, how would you know you could reduce your medication after just 14 days? Or how long does that take?
An intense lifestyle program really needs supervision by a healthcare provider and good monitoring of the blood pressure. And so too low is a really good question. We didn't spend a lot of time on that. But once somebody's top number starts getting under 100, they really are too low. And so they can begin weaning back a little bit on something. And usually that's best done with the advice of a provider. And so, I remember Bob doing something for a reunion one time. He decided to get on a real exercise kick, and he had to look good for this high school reunion or something. And so he was exercising and eating right and doing everything he needed to. And pretty soon his blood pressure was in the 80s, and he was feeling dizzy and lightheaded and like, that's why I talked about old people, because they're particularly vulnerable to falling over and hurting themselves when the blood pressure starts getting too low. A younger person will sense that dizziness a little bit better and have better balance and resilience to that symptom. But, when you're making big lifestyle changes and implementing some of these things, you need to have a blood pressure cuff at home. You need to be monitoring. And when you start getting down and you're always consistently in the low 100s, then you can start thinking about cutting back on medicines. Usually you want to cut back on medicines. You don't generally, most of the time, lifestyle all by itself will not make you have a blood pressure that's too low. It's the combination where you're still on medicines and you put it together with a bunch of lifestyle things that sometimes can make you too low, because the medicine, you can't overcome that impact, but your body deals okay with these other lifestyle things to a great degree. Now, it could be that if you had too many herbal kinds of things, that it might be a problem too, because herbals can work like a medicine. So I'd be cautious even there. If you were doing hibiscus tea and beetroot juice and pomegranate juice, because you just love drinking red things all day long, then I might say that if your blood pressure got down and you were always in the low 100s, you ought to start cutting back on that.
Okay, cut back on one of the red.
Yeah, you got it.
Can you purchase beet juice at a regular grocery store?
I have not. I hate to shop. And so I have to admit that it's probably available at some stores, but I don't know that you'd find it at every grocery store. And I don't recall seeing it there. So I think you might need to find it at a specialty store, a co-op, a nutrition co-op that specializes in that. I know the beetroot powder is very, very easy to get online. And that's probably a good source and a good way to do things. And you can then create your own juice by just stirring it into water and make your own.
Can you just eat a lot of beets?
Because the powder is preserved. I mean, it's dried, and so you don't have a shelf life that's a problem with it. So I would recommend that over looking for a liquid.
Yeah, that sounds good. All right, we have a couple of questions about garlic. So I'm hearing from friends and relatives taking garlic can reduce blood pressure. I think I saw that in your presentation. What about garlic pills? And can taking garlic
You-
pills be contraindicated with blood thinners?
yeah, definitely. You need to think about that. Ginkgo and garlic and stuff like that definitely affect the blood thinner effects. And so one has to be careful about those interactions and talking with a healthcare provider. If you're going to take a bunch of supplements, whether it's, beetroot juice or garlic or whatever, and you're on a lot of medicines, it is definitely worth talking and saying, hey, what's the interaction here? Is this okay? And, a lot of healthcare providers are not all that familiar with the herbal kinds of things. And so sometimes you get pushback from that. But it's, trying to deepen the conversation, getting them to help you understand the impact. And if it's just going to lower your blood pressure more and they're worried about that, then can I cut back on the blood pressure medicine? That's an easy one. But the blood thinner kinds of things, you don't want your blood too thin, you don't want to bleed too easily, and so that can be more of a issue for sure. And usually they're not, and it's not generally a good idea. Most people who are on blood thinners are on it for a very potentially life-threatening reason. And so it's really, really important to make sure that that is well regulated.
Can get
I have a few
complicated.
questions.
Yes.
Okay. With regards to calcium channel blocker for vessels to contract, and then there's something you says about opening up blood vessels. So could you just explain the two differences?
So in order
and
for
what
the blood vessels have muscle around them that helps them to squeeze down when they need to, and then the muscle can relax when it needs to as well. And so one of the things that makes muscle contraction an important element for muscle contraction is calcium. And that's true in your blood vessels. And so if you give a calcium channel blocker, what you're doing is making it more difficult for that calcium to work and help with that muscle contraction. And so that means the blood vessels are going to be more open. You're blocking that calcium, you're blocking you're reducing the contraction. And so the blood vessels are more open. And when they're more open, blood pressure is lower and the work of the heart is lower. Did that make sense?
I think so. Yeah, I'm jotting this down. Blood pressure is, so when it's open, blood pressure is lower.
Yeah, so when your blood vessels are nice and wide open, the blood pressure is lower. When your blood vessels are very, very tight and contracted and squeezed down, then your blood pressure is very high, because it takes a lot of work for the heart to move blood through a narrow vessel versus a very wide vessel. You think about if you're trying to drink through a straw and you drink through one that is, just like one of those things that you stir your coffee with, that's like less than an eighth of an inch in diameter. And then you think of a big straw, that you would use in a milkshake or something like that, that's about a quarter of an inch. If you're just drinking water up there, it's a whole lot easier to get the water through. It doesn't take as much effort to get the water through the big straw. Okay. And so vessels that are more open is the goal when you're treating blood pressure.
In order to be able to do that, it's diet and medication, the combination of the two.
And exercise.
Medication. That medication you mentioned, valsartan, is that one of the? Okay.
That's one of the ACE receptor blockers, and a very common, very well tolerated medicine.
You mentioned about beta blocker. Is that what that is? Whatever that is.
So beta blockers are things like probably some of the most common ones that people are taking are things like metoprolol or carvedilol or atenolol. And so you recognize that ending, the olol ending, and those are beta blockers.
And what does that particular one do? Open the vessels or contract the
So
vessels?
again, it opens the vessels more, but in a different way, because
Okay.
it impacts some of the receptors in your blood vessel that are triggered from your nervous system when your nervous system is on high alert.
Oh, okay. Okay. And then other question I had was just giving a short description of the top number and the lower number. I got down, the top number is the maximum force felt in blood vessels. Is that correct?
Right.
Did I write that down correctly?
And so, yep, that's the maximum force felt in that blood vessel. How hard the heart has to work to move blood.
Ah, how hard. Okay, how hard the heart vessels.
So how hard the heart has to work to move the blood.
Okay, how hard work.
And the bottom number is when the heart is just resting. You know, it's its chill time. And so how much pressure is there when the pump is relaxed and the heart is getting refilled for the next squeeze?
Okay. Okay. Okay, I think that was it. Thank you. Thank you so much.
You're so welcome.
Great questions. It's like we need to have like this walk through the heart where we can actually see it, like, you know, pumping and understand it. And it would be very cool to
I know
that.
God has made us such a magnificent machine.
Right.
You know? Oh my goodness, it's amazing.
There are a lot of ways for us to ruin that machine, but there are a lot of ways for us to fix it too. And God gives us lots of chances to do that. And He's given us a lot of things in creation that are helpful in doing that.
So one last question. Why does salt give you high blood pressure?
Okay, that's a super good question. Salt attracts water. It holds water. And so when you eat a lot of salt, it increases the saltiness that's absorbed, like anything that you eat. It's absorbed into your bloodstream. Nutrients, these elements, your vitamins, your minerals, your salts, all of that stuff gets absorbed. And so if you have too much salt attracts that water, it holds the water. If you think about it, you go out and you salt your walk, walkway, when in the winter, when there's going to be ice. But let's say that you see those big grains of salt sitting there. What you'll see is a ring of water around that, a ring of moisture. If the salt is just sitting there without any snow or ice, that salt will pull moisture from the atmosphere and from the ground, from the sidewalk toward it. Salt does the same thing in our body. So when it pulls that water and salt together, it's held inside the body and it increases the volume. So when you increase the volume inside the blood vessel, that creates more pressure, more stress on the blood vessels, and it's more for the heart to circulate, and so it increases the blood pressure that way.
Interesting. So it actually expands the vessel,
the volume, the amount of blood that's there.
Interesting. So, well, that's unfortunate.
And so diuretics as a medicine counteract some of that because they make you lose the water, and they either make you lose the sodium or potassium or something like that, one of your body salts with that often.
Wow. Interesting. Well, we really appreciate all this information. I don't see any more questions.
Okay, well, good.
I want to make
I'm
sure
out
I
of the hot
didn't
seat.
miss anything. I want to make sure I didn't miss anything.
Okay.
I did think it was interesting that you had on there lack of sun exposure can also increase blood pressure. I thought that was that's an unusual thing.
God made us to get outside and get some good vitamin D. And I think that some of that too is just fresh air. Being outside, it's not just the vitamin D, but being outside in nature, I believe, is a good stress reducer.
Right, and the blues and the greens that are outside. and-
Exactly
Yeah.
right. Those are God's
So
stress
with vi-
reduction
I'm sorry.
colors.
One more
What was
question.
that?
So
Yes.
would vitamin D help in some form, taking it as a capsule, to help reduce high blood pressure?
It may indirectly, and I don't have the numbers on that exactly, but most people are vitamin D deficient, and there are a lot of other benefits. And so I would say that for 75% of the people that I see and where I actually check their vitamin D levels, they need a supplement. And so there are a lot of other health benefits. Even if it doesn't lower your blood pressure a lot, there are some other bone strengthening, as well as other maybe even cancer preventing types, immune boosting types of effects of vitamin D. And so I highly recommend a supplement.
Okay.
Wonderful. Well, thank you so much for your time. Really appreciate it. This was very interesting, very informative. So we want to thank Dr. Holly Gadd for coming, and we want to thank all of you for being here. And we hoped it was helpful to you. You learned something this evening. We want to invite you to our next Tuesday with the doctor, with Dr. Suzanne Mesidor, who will share on the topic of the menstrual cycle on Tuesday, March 28th at 6:30 p.m. Other information
more
can
thing,
be
I'm
found at
sorry.
our website at joyoftroy.org. We hope you have a wonderful
One more
evening.
thing before she goes. How do you spell your last name? And your first name is Holly, Holly,
And my last name is Gadd.
Gadd. Gadd.
Right.
Okay.
Correct.
Are you taking new patients?
Well, I live down in near Chattanooga, Tennessee.
Oh wow! Okay. We'll have to fly in. Have to fly over there.
And most of my work is in the emergency department, as well as at a clinic for patients who don't have any insurance.
Oh, that's wonderful. Bless you. Bless you. Mm-hmm.
Well, good luck in your venture.
Yes,
All right.
yes. Okay, thank you.
Thank you
You're
so
welcome.
much.
Bye-bye.
Bye-bye.
Waiting for